What's going on, everyone? Welcome back to the Rehab Science Podcast. I'm your host, Dr. Tom Walters. In today's short episode, we will be looking at the types of injuries broken down by tissue type. So looking at things like muscle strains, ligament sprains, cartilage injuries, tendon injuries, basically kind of going through these and helping you figure out what you might have going on. If you have an injury, looking at common symptoms, the location of symptoms if you have an injury like this. These are essentially the questions that most patients come into physical therapy asking me. If we have pain, we want to know what's causing my pain. And really, when people are asking what's causing their pain, from a physical therapist standpoint, I'm thinking about what tissue is most likely to be causing their symptoms. So learning more about these symptoms and these different tissues will essentially help you come up with a treatment plan that's specific to that type of injury. If we look at something like a muscle injury versus a cartilage injury, the treatment plan for those may have some similarities, but they would also be different because each type of tissue injury is going to have a certain type of certain impairments that go with it. Maybe one injury usually causes weakness. Maybe another type of tissue injury causes joint instability. And so we would tackle those types of impairments in different ways. So you want to start with figuring out what type of tissue have I injured, and then that will help you figure out how you move forward. If you want more detail on these things, all of this is outlined in Chapter 7 in my book, looking at the types of injuries. The first area of injury that's going to be probably the most familiar to most people are muscle strains. So in something like this, we're thinking about that middle part, right, like the muscle belly, where those muscle fibers are. So if you're thinking about, maybe your hamstring, if somebody has a hamstring strain, they'll usually feel it right in the middle of the back of their thigh. So not behind the knee so much or up at the pelvis where the tendons are for the hamstring, but right in the middle of the backside of the leg where the actual muscle fibers, where that muscle belly is for the hamstring. We could think about, what's another good one? Maybe like a groin strain, right? Lots of athletes get groin strains. And so on the inside of the thigh, maybe you have pain in those muscles, kind of in the middle area where the muscle belly is located. Muscle strains typically happen when a muscle is contracting forcefully. So what will happen is the muscle is squeezing and contracting, it's shortening to move our body. And if you have a contraction that's extremely forceful that it goes past the capacity of that muscle fiber, you can actually tear the muscle fibers. And this is most often seen during eccentric contractions. So an eccentric contraction is one where our muscle is contracting, but the muscle fibers are actually getting longer. So if you think about an example I like to use is, imagine you're doing a bicep curl. You're picking a weight up and down and working your bicep. The up phase where you're bringing the weight up, your bicep is contracting and shortening. That's sort of like when you go to flex your bicep to show it to someone else. As you bring that dumbbell up, the muscle fibers are contracting and the muscle fibers are actually coming together. The muscle's getting shorter. On the way back down, as you lower the weight, your bicep is still working, but it's contracting and lengthening to slowly lower the weight. If you didn't contract the muscle, gravity would just slam it back down and you might injure your elbow joint. So whenever you do a weight training exercise, a strength exercise, you'll have a concentric and an eccentric portion to each exercise. And you're thinking about concentric as the muscle shortening and contracting, eccentric is when it's lengthening. And the eccentric contractions are where we will most often see muscle strains. So sprinters are a good example. So imagine somebody's sprinting and they injure their hamstrings. They suffer a hamstring strain. This will typically happen during that eccentric portion, which for a sprinter is when their knee is straightening. They're putting their leg back out to take the next step. So as their knee swings into extension, their leg swings out, their hamstrings have to act like a brake. They will contract but lengthen to allow the knee to extend. And in that moment, because of that forceful eccentric contraction, that's where we'll often see hamstring strains. That's just one example of one that comes up fairly often. When you're thinking about muscle strains, they'll be broken down into grades. So a grade 1 muscle strain is one where there's minimal impact to function. The person won't have much pain. They'll still have good strength. The pain will be minimal. They can actually stretch the muscle, lengthen it, and they don't have too much pain with that. So those are kind of the main, the main things you'll see with grade 1 strains is that there's minimal impact on function. You won't usually see other things like bleeding and bruising in the area. As we get into these more severe muscle strains, you will see that there will be ruptures of as the muscle fiber tears and blood vessels tear, you'll see bleeding in the area. If you've ever seen a really bad hamstring strain on the back, you'll notice on the person's thigh that they have bleeding and bruising in that hamstring region. So grade 1, minimal impact on function, some pain, but they still have decent strength and ability to stretch. In a grade 2 muscle strain, we'll start to see swelling, bleeding, weakness, and a loss of range of motion. So now we actually have some of the muscle fibers being torn. And then when we get to grade 3, this is where we have a major tear. This would be evident on imaging. So maybe on an MRI, you could see a tear in the muscle fiber. In some cases, reconstructive surgery might be necessary. We'd actually don't see, at least in the area I'm in, I don't see a lot of patients who've had reconstructive surgery for muscle tears, but maybe if you work with more athletic populations, you might see this more often. Okay, so that's our first category, thinking about muscle strains. So you're thinking about pain, maybe a loss of strength, maybe lost mobility, and the injury would be in the kind of mid part where the muscle belly is located. So usually it's kind of the middle part of the person's limb. After that, we have tendon injuries. Now, if you think about your muscle connects to bone via tendons. So on either end of a muscle, there are tendons. And when somebody has pain kind of in a muscle, in that muscle region, that's what we're trying to figure out is this a muscle strain or is it something more related to their tendon? And when somebody has a tendon injury, these will kind of have a spectrum ranging from what we now call tendinopathy. This is what we used to call tendonitis. Sort of, you can think of it as almost like a irritation of the tendon. And then you can have all the way up to tendon ruptures where the tendon actually pops off of the bone. So you might think probably the primary example most people think of as a Achilles tendon rupture where it pops off of the heel bone, the calcaneus bone. Most tendon issues that people develop are more of these overuse, repetitive type conditions where they develop a tendinopathy. So we can think of lots of examples. Achilles tendinopathy, where the person maybe they're a runner and they've increased their mileage, or now they're running uphill and they develop Achilles tendon pain, or maybe they're a basketball player or a volleyball player and they develop patellar tendinopathy in their patellar tendon on the front of the knee. Maybe it's a tennis elbow or a golfer's elbow. Those also fall into the tendinopathy category. Usually they're doing some activity and they're doing it often and the tendon gets irritated. So you have most people you'd see who probably have those repetitive overuse kind of tendon situations, but then you also have situations where the tendon, again, is torn or ruptured, and those are usually high force situations where, say, like they rupture their Achilles tendon. Maybe you hear a lot of these with maybe a pickup game of basketball. The person steps back with their leg, they step back and go to push off, and they hear a pop. They don't always feel a lot of pain. They'll hear a big pop and not know what happened, and they've popped their Achilles off of the calcaneus bone. Patellar tendon ruptures sometimes happen where the person has some kind of forceful landing and they tear their patellar tendon. But again, when you're thinking about tendon injuries, most of the cases are going to be more of a tendinopathy where there's an irritation of the tendon. If tendinopathy goes on a long time, sometimes you'll also hear the term tendinosis. This will sometimes be mentioned if the person has an MRI. The radiologist might see there's evidence of tendinosis, and usually this is like a thickening of the tendon. It still falls into that tendinopathy category. So of course, because tendons are where our muscles attach to the bone, the tendon is going to attach near a joint. So with tendinopathies, the pain will be closer to that joint. So again, if we think about the hamstrings, a hamstring strain in the muscle would be more in the middle of the thigh. A hamstring tendinopathy could occur at either ends where the hamstring attaches behind the knee and then attaches up by the buttock area. So in those cases, if it's a tendinopathy, the pain will again be closer to the hip joint or closer to the knee joint where the tendons are located. If you think about something like tennis elbow, it involves our wrist extensor muscles on the top side of our forearm, but the tendon attaches up by the elbow. So when someone has tennis elbow, the pain is up near the elbow at the tendon, not in the middle of the forearm where the muscles are located. So that's kind of one way you can start to think about, is this a tendon pain or is it a muscle strain? With tendons, you also won't usually see bruising and bleeding. They'll just hurt, but you won't see discoloration. If there was a really severe tear, like a rupture, a bulge, and then blood vessels will be torn. You might see some discoloration, but usually not to the same degree as a muscle strain. Pain will be created when the tendon is loaded. So if you're a runner with Achilles tendinopathy, usually people will have pain when they are using the tendon again. So say they go running, something that puts stress on the tendon. And people will often also say that when the tendon gets warmed up, it stops hurting. So that can be a sign of tendinopathy if you've got pain when you load the tendon, but as it gets warm, it starts to go away. And when we look at impairments with tendon injuries, they're similar to muscle strains. Because it's the musculotendinous unit, it's all connected. If a tendon is injured, usually mostly we'll see weakness. So the person, if you've injured, like say your Achilles tendon is hurting, you might have a difficult time doing something like a calf raise because of that pain. So when we measure, if we're trying to measure strength of the calf muscles, the person might appear weak because of the pain in the tendon, and that sort of limits their ability to generate force with that musculotendinous unit. So these can be a little tricky because the muscle and tendon are connected. So a lot of it is looking at the location of the symptoms and what brought on the symptoms. So those two are kind of connected. We've got muscle and tendon injuries. Next, we've got ligament injuries, which a ligament injury is referred to as a sprain. Sometimes people get these confused. So a strain is a muscle injury, a sprain is a ligament injury. Ligaments, if you might remember, connect bone to bone. So they are structures that are intended to guide and restrain movements. So you might think about the ACL in your knee. A lot of people are familiar with the ACL. The ACL connects two bones, our femur and our tibia, and it's meant to kind of help keep those bones connected to restrain the tibia and femur from moving too far apart. If we didn't have ligaments, our joints would just be more likely to dislocate all the time. Ligament injuries tend to be high force situations. So if somebody tears their ACL or tears a ligament in their shoulder, usually these are situations where there was high force. So the ACL might be a soccer player who's running and pivots quickly and their knee twists and it tears their ACL. It could be with like a shoulder ligament. Maybe the person falls and they go to catch themselves and maybe it dislocates their shoulder and tears ligaments at the same time. There are some situations where repetitive loading can tear a ligament. One example that comes to mind is the ulnar collateral ligament in the elbow with baseball pitchers. Baseball pitchers, this is part of the reason there's a limit on the volume of pitches, especially when you're looking at young athletes, recommendations on the volume of pitches that they can perform. If they exceed that, you can have these sort of fatigue situations where the ligament eventually, due to that fatigue, can eventually tear if their pitch count is too high. So that one you might think of as more of a overuse kind of repetitive loading that as they throw more and more, it puts stress on the ligament and it eventually fails and tears. Ligament sprains are broken into three categories like our muscle strains. So with grade 1 sprains, the person will usually have pain, but they won't have any instability in their joint. And if you remember, because ligaments are holding two bones together, they really give us joint stability. So in that grade 1, we won't see joint instability. When we get into a grade 2 ligament sprain, we'll see pain, we'll see swelling, and then we'll start to see instability. So if the person's torn their ACL, they'll have pain, their knee might swell up, kind of balloon up, and then if we test it, we may be able to feel increased movement, sort of translational movement in the joint that wouldn't normally be there if the ligament was intact. And then when you get to a grade 3, you have a full ligament rupture. This is where we see major instability. Again, you see swelling. With ligament sprains, the hallmark impairment is going to be instability, which is the feeling that the joint is moving too much, almost like you don't have control of it. With ACL, maybe they're standing and they put weight on their leg and they'll feel like their knee's going to buckle or come apart, like they can't control it. In a lot of these cases, surgery is required, a reconstructive surgery to rebuild the ligament. We definitely hear of cases, though, where people can use their neuromuscular system to compensate and they can regain joint stability without surgery, but this has to be kind of taken on a case-by-case basis. If you think you maybe had a ligament injury, you might go through rehab for a few months, and if you still were experiencing joint instability, then a reconstructive surgery might be necessary. Okay, so those are ligament sprains. The next category are cartilage injuries. And you can really think about this as two subcategories. There's articular cartilage and fibrocartilage. Articular cartilage is the cartilage that covers the ends of your bones in your joints. So this would be when there's a breakdown in articular cartilage. This is when we think about getting arthritis, osteoarthritis. That type of breakdown of articular cartilage is typically degenerative. So it'd be considered, it's kind of a slow, like a lot of times people have heard the sort of wear and tear type of terminology, but basically it's a slow process. It's often an age-related change. You see a breakdown of that articular cartilage with time. It can be sped up though if you've had a trauma. We see this with people who have had ACL tears. They're often more likely to develop osteoarthritis in their knee because of that trauma to the knee joint, maybe where they tear their ACL, their bones hit together, maybe they have a bone bruise that damages the articular cartilage, and they're more likely to get arthritis as time goes on. And then you can have the other category. So that was the articular cartilage that covers the ends of our bones and our joints. Fibrocartilage would be structures like your meniscus, the labrum in your hip and shoulder, the discs in your back and your spine. Your intervertebral discs are also fibrocartilage. All of those can be injured as well, and they also can be degenerative or traumatic. Most of the time in rehab, we're probably seeing more traumatic injuries, like someone tears their meniscus or they dislocate their shoulder and tear the labrum in their shoulder. If they have a disc herniation, in a lot of those cases, the person had something traumatic, sudden kind of happen and experience that injury. But all of those can also be degenerative too. Meniscus tears are a good example. There's a lot of degenerative meniscus tears where the person never really had a trauma, but they play tennis or run and they're noticing that their knee is swelling, and they go get an MRI and there's evidence of a degenerative meniscus tear. So with these cartilage injuries, because they're present at a joint, you'll often see pain. You'll see swelling around the joint. If it's something like a meniscus tear or arthritis in a knee, for example, that might feel warm. The joint will feel warm. It might even be kind of red. And then you may also see joint instability like the ligament sprain. So particularly with meniscus tears and labrum injuries in the shoulder, the person may actually have instability again where it feels like their shoulder is going to dislocate, or their knee feels like they can't control it well. So you may see things like that. You can also sometimes see a loss of joint mobility. This would be more with the articular cartilage type injuries. Again, thinking about that kind of arthritis side of things, the cartilage that covers the ends of our bones. If you have a breakdown in that articular cartilage, individuals may lose range of motion in a joint, and they'll usually have pain with that range of motion. Sometimes you'll actually hear kind of crepitus and grinding. Our articular cartilage reduces friction in our joints so that they can slide really easily and smoothly. If you have a breakdown in articular cartilage, you get to situations where you're having kind of bone-on-bone contact. And I've had patients like this in the past. One I remember really specifically was a person who had osteoarthritis in their shoulder joint. And I remember when I would work range of motion with his shoulder joint, as I'd move him through passive range of motion, it would sort of catch and grind, and his shoulder would kind of catch, and then it would let go. It was this ratcheting kind of feeling, and he didn't have much pain with it, but it was actually it was difficult for me to work on range of motion because of how intense that feeling was. Often with these, there can be surgical reconstruction if the person doesn't get better with rehab. So you can have meniscus repairs, you can have labral repairs in your shoulder. If, say, you're a person who's gone through rehab and your shoulder keeps dislocating, you might have the labrum repaired. And then if we're looking at the articular cartilage, that joint cartilage, this is where we see joint replacement. So if somebody has really, the cartilage is really, broken down and injured in their knee joint or their hip joint, then the knee replacement or hip replacement, a joint replacement surgery is the kind of final intervention for those types of cartilage injuries. Another category is nerve injuries. So we can think about our central nervous system and our peripheral nervous system. Of course, you can have injuries to your central nervous system. This isn't one that I'm going to cover a whole lot, but if you think about a brain injury or a spinal cord injury, traumatic brain injuries, spinal cord injuries would be injuries to the central nervous system. Out in the peripheral nervous system, this is what we tend to see more of in orthopedic physical therapy, but they would be different types of compressive and tension-based injuries to our nerves. So One good example of a stretching injury to a nerve is a whiplash injury. If you get in a car accident and the person's head kind of whips, not only could they have a brain injury, a central nervous system injury, but the whipping of their neck can actually injure the nerve roots as they exit the neck. And oftentimes this is a stretching type of injury. We see these sometimes in sports, like in American football or in falls. If the person's tackled and lands and their head sort of gets stretched to one side, it can stretch the nerves as they exit the neck and go down to the shoulder region. These can cause palsies where the person has, say you injure the nerves on the left side of your neck, it can cause numbness, tingling, and weakness in that left arm. There's also compression type nerve injuries. So carpal tunnel syndrome is a good one where the kind of prolonged compression on the wrist, particularly for people who work at computers, that compression on the median nerve that runs through the carpal tunnel can reduce blood flow to the nerve. And then over time, that can cause carpal tunnel syndromes, weakness, changes in sensation, atrophy of the muscles in the hand. Some disc herniations, if they're really large, they have to be really large disc herniations. If you had a low back disc herniation, it could be large enough to actually compress one of the spinal nerve roots as it exits the low back, and again, could cut off blood flow to it and cause these types of nerve symptoms. Most disc herniations in the spine actually aren't that large, and it's more just the inflammation that causes the symptoms. So with nerves, you'll see from a symptom standpoint and impairments, you'll see the person will have a change in sensation. So they might get the numbness and tingling, traveling type pains. And then if nerves become severely compromised, you'll start to see weakness in the muscles that nerve goes to. So again, carpal tunnel syndrome is a good example. If the median nerve is severely compromised, it innervates some of the muscles in our hand. So if the nerve, as it gets worse and worse, you'll start to see atrophy and weakness in the muscles in the hand, and they'll shrink down, and the hand will have this characteristic appearance of median nerve compromise. Nerve injuries are usually a little easier to pick up because the symptoms are unique, the numbness, tingling, and pain, the lightning kind of referral type pain. But if you're trying to figure out kind of the severity of a nerve injury, there's a particular test that can be ordered. Your doctor can order it. It's called a nerve conduction velocity study, and they can look at how well kind of the velocity of impulses that are traveling down the nerve, and they can detect areas. Say you're wondering, do I have carpal tunnel syndrome? They can do a nerve conduction velocity study and look at, if the conduction is slowing at the wrist, then they might be able to identify, this is actually a true carpal tunnel syndrome. Or maybe there's nothing going on at the wrist and it's somewhere else along the nerve's path. Maybe it's up at the neck or in kind of the shoulder armpit region, and it kind of help you figure out where is the nerve being compromised. The last major category of tissue injury that we look at are bone injuries. Bone is kind of interesting. It's technically categorized as a connective tissue like ligaments and tendons and fascia. And bone, most people are going to be aware, of course, of fractures. There's all kinds of different severe kind of bone injuries where you could have compressive fractures, there's spiral fractures, there's bending fractures. There are fractures where the bone breaks into fragments. There are all of these kind of severe injuries. But below that is another category called bone stress injuries. And this is where we'd find things like stress fractures or just sort of like weakening of the bone even before it fractures, especially in athletes that put stress on their bone in high volume. So runners with stress fractures and stress fatigue kind of injuries, gymnasts and dancers, with these stress reactions in the vertebrae and their low back. So basically there are situations where there's micro damage to the bone, but that micro damage is accumulating faster than the bone can remodel and heal. And often in these situations, just a little bit of rest allows the bone to catch up and remodel, and the stress injury heals. So, of course, with bone, if somebody has a really severe bone injury, like a fracture, they'll have severe pain. Bone has tons of nerve endings and a really good blood supply. Anything that has a lot of nerve endings is going to create a lot of pain, so bone fractures really tend to hurt a lot. The great thing about bone, though, is if you do heal it and have a fracture or a stress injury, because it has good blood flow, usually just a little bit of rest and time, it will heal back to its full strength and actually just keep adapting and getting stronger. One other area with bones that you might hear about is something called avascular necrosis, or sometimes it's called osteonecrosis. And this is usually situations where the person's maybe had a fracture or some injury, and the bone doesn't heal appropriately because the blood flow has been affected to it. So the bone will slowly die, and this often happens at the ends of long bones. And so maybe the person has a knee injury, maybe they have a fracture in the bottom of their femur at their knee joint. And as that heals, maybe the blood flow is affected in some way and it's not healing appropriately. And on an x-ray, you might see bone will normally appear white, and then it starts to have this, the bone dies and you see a blackening of where it should have been white. And so physicians, when somebody has a bone injury, will check on this. This is why there's follow-up x-rays and things to make sure everything's healing okay. But if there was a situation where the bone was dying, you might hear this term avascular necrosis or osteonecrosis, and it may be that the person needs a joint replacement. There can be different bone grafts that can be done. So just another thing to keep on your radar. It's not as common, but sometimes you hear about avascular necrosis or osteonecrosis. Okay, so those are really the primary injury types by tissue. You've got muscle strains, you've got muscle strains, you've got ligament sprains, you've got tendon injuries, you've got different types of cartilage injuries, whether it's articular cartilage or fibrocartilage, and then you've got bone injuries and nerve injuries. Those are really the primary injuries you'd think about in the musculoskeletal system and the different tissues that can be injured. So I hope this is helpful to you guys. Again, this is what most people are wondering about, even though they might not realize it when they come into physical therapy, into rehab, and they have pain. They're really trying to figure out what's causing my symptoms. And this is how we often, as rehab practitioners, are thinking about these different categories of tissues and what tissue is most likely to be causing their symptoms based on what kind of symptoms they're having, how it happened, and where they're located, where the symptoms are located. So I hope this helps you and gives you a little bit clearer path forward if you're suffering from an injury right now. And I will see you guys in the next episode. Bye.